Time allotted for member statements has expired. We'll now move on to oral questions put by members to ministers. The Honourable House Leader for the official opposition.
Thank you very much, Mr. Speaker. Spring Hill has been in the need for a new elementary school for a number of years now to replace the aging West End and Junction Road schools. And for the past number of years, Chignecto Regional School Board identified a new elementary school for Spring Hill a priority and on its capital list for the province. All that's needed right now is approval from the Department of Education. So since we haven't seen the government's capital plan yet, there's still some time to make sure that the elementary school for Spring Hill is on it. Will Spring Hill be receiving a new school project in this year's capital plan to the Premier?
The Honourable Premier.
Speaker, I thank the honourable member for the question. That school and all schools across the province that require either an A&A or a total replacement will be part of the assessment that will be done in the capital plan, and in due time it will be announced.
The Honourable House Leader for the official opposition.
Now, this is like a lot of schools around our province. Spring Hill is on top of the list for a new school, on top of the Chignecto School Board's list. The age and the condition of the schools is affecting programming. These schools have leaky roofs, outdated plumbing, and overcrowded gymnasiums. They are long-standing problems, but for some reason the people of Spring Hill have been passed over by this government year after year. There have been many questions about this government's policy about building new schools, as the Auditor General has as well. And the Spring Hill kids do deserve a new school. Will the minister get on with it and commit to building a new school that they need and deserve?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I agree with the member. The evidence on the needs for that school are there. That is one of the schools that does need to be done in this province. We are currently undergoing our capital planning process. Dr. Glaze, the Auditor General, have both told us that we need to have a longer-term planning process, and of course we want a process in place that the public will have full confidence in. And once we do have that list complete, we will be announcing that to the public.
The Honourable Leader of the New Democratic Party.
Thank you. My question, Mr. Speaker, for the Premier is about long-term care. People in hospitals waiting for long-term care placements are not going to be helped by home care services. They're in these hospital beds because they cannot be discharged to their homes. Over the course of the last 5 years, 21% of our hospital beds in the province were filled by people waiting for a nursing home placement. Mr. Speaker, does the Premier not understand that the real, actual needs of the seniors of our province are exceeding what his government is actually really providing?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. Very important question, as you know. In 2013, we came in, there was 2,500 Nova Scotians on a wait list for long-term care. We've reduced that by over 50%, continuing to ensure we provide those support. That's really inappropriate, Mr. Speaker, for the contact coming from the member opposite, suggesting that the only reason these people were moved because they died, which is actually completely inaccurate and really disrespectful to seniors in this province, Mr. Speaker. If they would like me to answer the question, I'd be more than happy to answer it on their behalf. But let me tell you, we've reduced that wait list by over 53. There are still too many people on that list. What we've heard from seniors is that they want to actually remain in their home as long as possible. We continue to invest in home care. We continue to invest in the caregiver allowance to ensure that Nova Scotians who can and want to remain in their home will do so with the supports. We know there's more work to do around continuing to reduce that wait list, and we will continue to do that.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, it is not myself or our party. It's rather our province's Auditor General and auditors from the National Accreditation Canada who've noted that our healthcare system in Nova Scotia is stressed by the excess of nursing home patients in acute care beds. This compromises patient flow in our hospitals and is creating all kinds of situations around the province where patients are being treated in hallways, in corridors, and Lord knows where. Mr. Speaker, does the Premier not understand the impact his decision to not open a single new nursing home bed is having on the hospitals in Nova Scotia?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. That is part of the challenges that we're facing in hospitals, Mr. Speaker. There's no question that we have, and that's why we've continued to reduce that list by more than 50%. In our first term. We're going to continue to work, but let's not blame everything that's happening in our hospital based on no long-term care beds, Mr. Speaker. The fact of the matter is, for decades, under successive governments, the QE2 was left there, Mr. Speaker. Every government knew the challenges but ignored them. That's part of the issue down there. We're going through the massive restructuring of primary health care in the province of Nova Scotia. The investments we're making at Dartmouth General will alleviate some of the challenges that he's referring to. The investments we're making at HI will alleviate some of the issues that he's referring to. The investments in home care, the investments in caregiver allowance will alleviate some of the challenges. The difference is, Mr. Speaker, we're not ignoring the issues in front of us. We're working with our partners to ensure that we deliver the health care they deserve.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. What is troubling us is not investment or investments. What we are troubled by is the non-investment, the investment in 0 new nursing home beds over a 5-year period. Last month, the government of New Brunswick announced plans to create more than 1,000 beds for nursing home residents and people with dementia over the next 5-year period. And in Ontario, the government is planning to open 5,000 new nursing home beds by 2021 and an additional 25,000 over the next decade. Mr. Speaker, why can't the Premier see that seniors in Nova Scotia need new nursing home beds as badly as seniors in Ontario and New Brunswick?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Mr. Speaker, I want to tell the honourable member while he's watching what's happening in other provinces, he might want to pay attention to the fact that those who are waiting for long-term care beds in this province, the list is going down. It's been reduced by over 53%, Mr. Speaker. We're going to continue to work with our partners across the province to continue to ensure that we provide the long-term care and other acute care, health care that's available to our communities, and we'll continue to work with our partners to ensure that every community gets access to the primary health care and long-term care that they require.
The Honourable Member for Inverness.
Mr. Speaker, yesterday I asked the Minister of Labour and Advanced Education about the $2.7 million loan to Acadia University to update the Cutton House residents. Mr. Speaker, that money was originally announced as part of, as coming from the Department of Labour and Advanced Education, but we know that it actually came from Housing Nova Scotia, and it was approved in this legislature, Mr. Speaker, for affordable housing. Now, the Minister of Labour and Advanced Education was quick to dismiss this as somebody else's problem yesterday. He refused comment to the media initially, and the Minister of Community Services has also refused to speak publicly about the loan. I'll table that. The question, at what point did the Minister of Community Services become aware that money for low-income housing was being used to update a university residence?
The Honourable Minister of Community Services.
I want to thank the honourable member, and I became aware of that once the loan was paid off.
The Honourable Member for Inverness.
But that's not the point, Mr. Speaker. This was money that was approved in the legislature for affordable housing. So, Mr. Speaker, a spokesperson for Housing Nova Scotia previously defended the loan as addressing a gap in student housing. But if we look on the Housing Nova Scotia website, there are no programs for with such a mandate. In fact, the only program is a parent-student affordable rental housing program, and I'll table that, Mr. Speaker. Adding to the confusion, the Minister of Community Services recently refused an interview on this subject. So, Mr. Speaker, was the Minister of Labour and Advanced Education correct when he said the loan should never have been made? Or was Housing Nova Scotia right when they said the loan was needed to fill a gap in student housing?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. Again, this was a loan that was given to Acadia during the NDP's period in power. So when I look at the press release that was put out at the time, it indicates it's from government. It doesn't say it came from Labour and Advanced Education. It doesn't say it came from Housing Nova Scotia. Would I have preferred that it was clear about what was actually happening? Yes, I would have. What I can tell the honourable member is that Acadia repaid the loan in full. Thank you.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, today in the Cape Breton Post, I am very upset to read that every ER except for the regional will be closed on Cape Breton Island starting today and some until Thursday. Every ER. Just the other day, I was informed that the mobile care team at the New Waterford Consolidated Hospital has once again been taken off the schedule. for the next 3 months. People in Waterford need that service, Mr. Speaker. They depend on it being there. And I hope that I or family members do not have to go to the Cape Breton Regional Hospital over the next week because they will be worked to death. Mr. Speaker, it seems that the mobile care team in New Waterford has essentially been eliminated. Will the Minister apologize to the people of New Waterford for taking away their health care services?
The Honourable Minister of Health.
Thank you. Thank you, Mr. Speaker. I thank the member for the question. Indeed, Mr. Speaker, we continue to invest in healthcare services for the people of Nova Scotia, including those in Cape Breton and specifically in the Sydney region, Mr. Speaker. Just yesterday, I had the opportunity to make an announcement which showed continued investment, expansion of nurses with our collaborative healthcare practices, Mr. Speaker. That's providing healthcare services, Mr. Speaker, to help those people that are showing up at ERs for perhaps non-acute issues, Mr. Speaker, things that can be seen by their family physicians or other primary health care providers.
The Honourable Member for Cape Breton Centre.
Good luck if that's at the regional this week. Mr. Speaker, the Minister seems to think that saving a few $1,000s is more important than providing primary and emergency care services to the people of Nova Scotia. It's no wonder that doctors across this province don't seem to trust the promises this government is making about health care. According to one burnt-out physician on the South Shore, doctors themselves are being forced to pick up the slack in primary care. Earlier this week, Dr. Diane Edmonds told reporters that she diagnosed a walk-in patient with advanced lung cancer. Imagine being diagnosed at a walk-in clinic, and I'll table that. Wrong one. Mr. Speaker, surely the Minister can agree that if you have to go to a walk-in clinic for a cancer diagnosis, that something is terribly wrong with healthcare in Nova Scotia.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member highlights, there are many different ways and means of receiving health care services in the province of Nova Scotia. Mr. Speaker, these include practices that are traditional family practices with independent physicians, Mr. Speaker, working, but also an evolution, Mr. Speaker, where more and more of these practices are evolving into collaborative teams, Mr. Speaker, where physicians are being joined by other healthcare professionals like nurses, family practice nurses, nurse practitioners, pharmacists, physiotherapists, and even social workers, Mr. Speaker, providing comprehensive care to people across this province, Mr. Speaker, and I'm proud this government has been able to continue to expand those services across the province.
The Honourable Member for Pictou Centre.
My question is for the Ministry of Community Services. It has been my experience that helping individuals who are on income assistance find accommodations is very challenging given the current amounts for the Minister's department. The average cost for a person to rent a bedroom with a shared bathroom, common kitchen, living area is around $500 in Pictou County area. However, under the Minister's current funding model, an IA recipient would only receive $235. I currently have a constituent who did receive $535 living in a rooming house that was grandfathered. Unfortunately, he had to move because bed bugs were eating him alive. My constituent found a room for $435, but now he's been reduced to $235. My question to the Minister, does the Minister feel that someone on income assistance can find proper living accommodations on this meagre amount?
The Honourable Minister of Community Services.
I want to thank the Honourable Member for raising this particular issue with me, and I'm happy to sit down with him outside the House so we can walk through and find out exactly what happened. What I can tell the Honourable Member, and I know that his concern for his constituent is genuine. What I can tell him is that we are in the process of revamping how we do what we do at Community Services, and when we finish our transformation, all of our clients will receive the maximum available for their housing. Thank you.
Honourable Member for Pictou Centre.
Mr. Speaker, everyone has the right to lead a healthy life in our province. However, it's getting harder and harder for those on income assistance to live that way. The current formula only allows an IA recipient $235 to live in a shelter and $535 if they choose to live in an apartment. And my question to the Minister, will the Minister commit to addressing this need by increasing this formula in this year's budget, or does my constituent need to enroll somewhere else to get income assistance?
The Honourable Minister of Community Services.
I want to thank the Honourable Member for his question, and I want to assure him that we're in the process of changing how we do what we do so that, in fact, this kind of thing does not happen. And I want to thank him for raising it for me here in the House today.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question is also to the Minister of Community Services. On March 5th, 2018, I met with a constituent named Bonnie Gibson, who was there to advocate for a disabled woman, Arlene Wright, who 2 months ago was forced out of low-income housing at the recommendations of her family physician because of the severity of the mold and the vermin in her building. Additionally, Arlene had been a victim of physical assault in that housing complex. She has nowhere to go. She would be living on the street right now if it wasn't for Bonnie, who has taken her in. So my question to the minister is, when someone who is in housing already is forced out of their housing because of mold issues, would they not be placed on the top of the list for housing rather than being told now that she's out of there, she has to wait another 2 years to get back in?
The Honourable Minister of Community Services.
I want to thank the honourable member for raising this question with me here in the House today. I want to assure her that we want our clients to live in safe surroundings, and I would, however, caution the honourable member that it is not appropriate to raise the names to identify people who are receiving assistance from Nova Scotia. It's not appropriate. We are outing them. We're putting their names out in the public, and I want to be clear with the honourable member that I don't mind if she raises that with me individually, but you need to be very careful. Thank you.
The honourable member for Cole Harbour Eastern Passage.
I thank the member for the reminder. Next time I'll bring the consent form that she signed. And I guarantee you, as a health professional, confidentiality is always a priority, but she is desperate. She wanted to go to the news, and I said, no, I would prefer to speak to you directly because I know that you've always been responsive when I brought it forward. So I had her permission. This woman also goes to another program during the week, and her belongings have been put in storage. She is doing the best that she can to live independently, but without a location to go to, she has been set back in her efforts. All she wants is a safe place to live. My question is, what options are available to her and others on disability who need to relocate for their own safety, especially, and what the strategy is moving forward as our population ages?
The Honourable Minister of Community Services.
I want to thank the honourable member for, again, her question. We have a number of programs that can assist people who would prefer to be doing different things during the day. We've, in fact, added $1 million this past year to our budget to expand our day programs, Mr. Speaker. And again, I would be happy to speak to the honourable member about this particular case outside the House. Thank you.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Minister of Transportation. Rocco Point Road is a scenic dirt road in Saint-Anne-du-Ruisseau. Unfortunately, it runs through a coastal marsh and is prone to flooding. And the recent storm surge has caused some flooding, but the road also is in danger over the last number of months during the Perigean tides. TAR staff has been out to visit the sites and has posted a flooding sign. My question to the Minister, are there any other measures that can immediately shore up the Rocco Point Road and other roads like it that are prone to this kind of flooding?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and appreciate the question from the member. We will take a specific look at Rocky Point Road. Mr. Speaker, as I mentioned earlier in the week, in this wonderful province that we have, which is a virtual island, we are subject to the ebb and flow of the tides and some of the worst storms in the North Atlantic. And they are changing the nature of our estuaries. We had one yesterday from Chesapeake. We've got them. I'm aware of issues in different parts of Cape Breton, all along the area. And I think perhaps what we have to do is look at an analysis of what these implications here are and look at, on the longer term, the ways that we can deal with those ever-changing situations. Thank you.
The Honourable Member for Argyll-Barrington.
Thank you very much, Mr. Speaker, and I thank the Minister for his answer. The Rocco Point Road, ROCCO, is on a busing route, and residents do operate some small businesses, and now they have to keep a tide chart at home so that they don't cross over too much water when it's those super high tides that we have been having. They just need a reliable road, Mr. Speaker, and I believe that the road can be rebuilt, especially in a couple of those sections, to properly correct the flooding. So is the Minister able to provide any more detail or inquire with his staff on what the long-term fix is for the Rocco Point Road?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member opposite for the question. We will take a look at that in particular, and I'll get a report and make that available to the member. Thank you.
The Honourable Member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Natural Resources. Nova Scotians are questioning this government's commitment to a sustainable future for forestry in our province. First, the Liberal government backed off the clear-cut reduction targets that the NDP government had set, and now media are reporting troubling stories of questionable cuts that may be clearing old-growth forests. The pre-cut assessments are done by Port Hawkesbury Paper itself, and the Minister's Department only checks their assessment 1 in 10 times, and I'll table that. Does the Minister believe that this is adequate oversight to protect our high-quality forests against low-quality harvesting?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the Honourable Member for that question. We take very seriously our role in DNR in doing the assessments of our forest lots before they're harvested. As a matter of fact, we have an IRM process where the assessment is done. Everything is evaluated, whether it's an old-growth forest, whether there's habitat for different endangered species, and all those allowances are all made before determination is made. As a matter of fact, Mr. Speaker, I'd like to table this document that is a sample of the IRM process, how it's figured out, and allow members to have a look at this. Thank you.
The Honourable Member for Halifax Needham.
Mr. Speaker, I don't think Nova Scotian foresters are satisfied. There are troubling signs that this government's forestry policy is moving Nova Scotia towards becoming one big low-quality tree farm. Groupe Savoie's mill in Westville is the last operating hardwood mill in northern Nova Scotia, and it has only been operating 1 day a week for the past 2 months because it doesn't have enough quality hardwood logs. I'll table that. High-quality hardwood is worth more money and creates more employment per cubic foot. So how can the department say it is transforming the forestry industry to maximize high-value resources when the department is not even enforcing its own policies properly?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the member for the question again. Certainly we are enforcing it. When we hear of any violations in the department or any perceived violations by different stakeholders in the province, we certainly do investigate that. And if they're in violation of their approval of their permits, then we'll be dealing with that personally.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question for the Minister of Health. Over the past number of sessions, I've asked the Minister of Health to show support for those struggling with Lyme disease. To this day, too many people are forced to leave the province to seek treatment because their diagnosis is not always made in a timely manner. People are increasingly aware of the risks and are going to greater lengths to prevent contracting the disease, but the healthcare system is not keeping pace. So my question for the Minister is, what specific measures is the department taking to address Lyme disease diagnosis and treatment, and how will they prevent people from having to travel to the United States for treatment?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member for bringing this topic to the floor of the legislature again. I know my colleague, formerly affectionately known as the Minister of Ticks, the member from Bedford, I believe, was quite active in bringing this discussion to the floor as well. But, Mr. Speaker, what the department's doing is following the national guidelines around the assessment and treatment of tick-related Lyme disease, Mr. Speaker. We continue to do that work, as well as promote awareness, which, as the member acknowledged, people in Nova Scotia are becoming more aware and being more proactive in our outdoors. Thank you.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. The issue of Lyme disease has been ongoing for many years, for sure. The impact on people's lives can be devastating. The province has made strides in making people aware of the dangers associated with ticks in certain areas of the province, but the diagnosis and education is simply not going far enough. So my question is, will the minister commit to developing a Lyme disease strategy that will target the gaps and unique circumstances faced by Nova Scotians struggling with this disease?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, with the ongoing work within the department and with our partners, Nova Scotia Health Authority, with physicians across the province, Mr. Speaker. Again, education both for the citizens of the province, how to be proactive in preventing tick bites, but also how to identify, but also with our physicians and healthcare partners in the primary care space, Mr. Speaker, to identify and treat appropriately. We work with them on training and getting information out there. Again, the guidelines that we follow in our healthcare system for the identification and treatment does follow our national standards, Mr. Speaker.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question through you is for the Minister of Education. Last year, the minister met with a constituent of mine, Miss Barbara Wynne, and I have her permission to use her name, about her son Eric, who attends the Harbourview Montessori School. Eric has a challenge learning, and attending the Montessori school has resulted in positive change in Eric's development, and he is progressing well in that environment. The challenge for his mother is the cost of the private institution and the fact that the local school board did not seem willing to assist with the cost. So the question for the minister is, will the minister address this issue of funding and assist Barbara and Eric by helping to fund Eric's tuition at the Harbourview Montessori School?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I thank the member for the question. We did send a letter to Montessori. Right now, they do not fit the criteria for subsidy because they do not have a specialization in supporting students with special needs. However, we have reached out to them to let them know what they do need to meet the criteria for that subsidy. In the meantime, we will be working with the regional executive director to see if there are alternative solutions to the challenges that student and family is facing. Thank you.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And the minister has outlined a long list of ways that public education can assist Eric. This family found a resolution without having to disrupt Eric's progress and creating new issues. And after today, the Cape Breton Regional Victoria School Board cannot be blamed for special education policies because they don't exist anymore. The responsibility will rest with the minister and his department alone. And in a letter dated December the 13th, and I quote, "You have my assurance that I will reflect on your family's experience as we strive to improve and enhance public education in our province." So the question for the minister is this: will the minister commit today to reviewing the funding for special education in cases like Eric's so their education is not impeded by bureaucracy?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. We do have funding recommendations that will be coming forward from the Commission on Inclusive Education. As the Premier has stated, we will plan on investing in those supports for the classroom, Mr. Speaker, so that we not only help this particular student, but help all those students in the system that currently aren't getting everything that they need from our education system.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Service, Nova Scotia. Mr. Speaker, Holly Taylor of North Alton had her driver's license renewed at Access Nova Scotia on January 15th of this year. She received a paper license and was told the real license would arrive in the mail in 2 weeks. 7 weeks later, she has still not received her license. Meanwhile, the white paper license has expired and Holly had to pay another $25 to renew that. My question, Mr. Speaker, for the Minister is, how does this system of having licenses printed in Ontario and mailed to Nova Scotia benefit Nova Scotians if licenses are getting lost in the mail, stolen or misdirected?
The Honourable Minister responsible for Service, Nova Scotia.
Thank you, Mr. Speaker, and I thank the member for the question. Obviously, in that particular case, it doesn't benefit at all. That's got to be an anomaly without question. So I can take the constituent's name and check that out to make sure that she's treated properly and we get that fixed up. With respect to the licenses, that was a regional program. The Atlantic provinces all signed on for one procurement, and it's really done in the name of security. These cards not only will be more secure from identity theft, but moving forward with advanced technologies in how we utilize our cards to have a one payment system, one identification system for all Nova Scotians and all Atlantic Canadians. There is an idea and a notion that not only does it advance security, but it's also better in terms of transactions and dealing between the public and the government. So we'll check that specific case and get back to the member. Thanks.
The honourable member for Kings North.
I'd like to thank the Minister for that answer. Mr. Speaker, Holly had to pay extra to restart the license process and was unfortunately even without a valid temporary license for a few days. Mr. Speaker, the government has said one reason for going to the new system was to enhance security. But for the sake of saving a few bucks, we have a system which isn't working for Nova Scotians and may be less secure. My question for the minister is this. Will the minister admit that having licenses printed at each Access Nova Scotia while you waited was really a much more secure system and gave much better service? And will he commit to reinstating the printing of licenses at Access Nova Scotia again? The
Honourable Minister for Service Nova Scotia.
Thank you, Mr. Speaker, and respectfully, no, I wouldn't agree to that. Number one, over the course of the contract, there's a $10 million saving for the province, which is big, but that's not even the most important part of this initiative. It's about the security and the fact that as we move to a digital government, every service or the majority of services that Service Nova Scotia provides, as a lot of times what's that? Stop interrupting me. I'm trying to answer the question. Sorry, Mr. Speaker. So, Mr. Speaker, it's in the name. It's in the name of security, and there's no question about that. We can't have those things happen. So, for the member's constituent, we can check that specifically. But this is a more secure system. It's a better system. The fact that it's an Atlantic Province procurement program with all of our sister provinces signed on means that it's an important move for all of us, and it will be a better system. Thanks.
The honourable member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Community Services. Nova Scotia has the highest rate of child and family poverty in the country at 22.2%. Child poverty is women's poverty. The 2017 report card on child and family poverty in Nova Scotia from the Canadian Centre for Policy Alternatives explains child poverty is intricately linked to the dynamics of women's poverty and the gender discrimination they face in care work and the labour market and the challenges of unpaid caregiving that falls disproportionately to women. I'll table that. Mr. Speaker, how does the minister expect to raise children out of poverty when this government refuses to take meaningful action to improve the situation of women and their families?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. As the member well knows, we are in the process of transforming our system at community services so that we can, in fact, serve families much better who are our clients, Mr. Speaker. I would note that according to Statistics Canada, between 2006 and 2016, the rate of poverty in Nova Scotia decreased approximately 17%. But, Mr. Speaker, I'm not saying that we're done. Far from it, Mr. Speaker. There's a lot more work that needs to be done, and I can assure the honourable member that we will be looking not just at the supports that we offer at community services, but at poverty across government, across all departments, Mr. Speaker. And I also want to assure the honourable member that unlike when her party was in power, we're not going to raise taxes for the poorest among us.
The honourable member for Dartmouth North.
Mr. Speaker, Karen Terrio of Feed Nova Scotia has said that individuals receiving social assistance are 30 to 40% below the poverty line. So definitely the work is not done. Meanwhile, the minister wants us to applaud a potential 2% increase in ESIA rates. In fact, after this increase, ESIA recipients will be poorer in buying power than they were in 2016, right after the last raise. A 2% increase and less buying power hardly sounds transformative. Mr. Speaker, does the minister acknowledge that her department is failing in its responsibility to improve the economic situation for women?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I would remind her that one of the things that we are most pleased about is that the federal government has joined this fight against child poverty, Mr. Speaker, and they have introduced the Canada Child Benefit. Now, this began in July of 2016. It gives families up to $533 per child per month to assist with, in fact, family expenses, Mr. Speaker. And I would say, having talked to accountants who have looked at this, that it has made a significant impact. I'm not saying that poverty is eliminated or anything like that, Mr. Speaker. I'm saying it has had a significant impact on the lives of Nova Scotians here in this province. Thank you.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Business. Last year, the government introduced a high-speed rural internet strategy to give Nova Scotians access to internet service that, I'll quote, is so essential to live, work, and operate in our modern world, and I will table that document. Mr. Speaker, I receive complaints on a regular basis from constituents like Jessica Jodry, who was a young teacher from rural Queens County trying to do work from home and can't, while her neighbour 400 feet down the road can. Jessica wrote the Premier with her concerns and only received platitudes about programs available to other communities, and I'll table that document. My question is, will the Minister address the real needs of people like Jessica with real solutions as opposed to a letter of platitudes and programs utilized in other places?
The Honourable Minister of Business.
Thank you, Mr. Speaker, and I do thank the member for the question, and the answer is yes, we certainly will. With the planning and preparation that's gone into the broadband initiative and the program that we're about to release and put out there for Nova Scotians for all to see, we've done a lot of work. The legwork will be in place, and the strategy will be very clear for all Nova Scotians. But more importantly, Mr. Speaker, over and above the plan, this is about money. Because of the fiscal decisions we've made, the fact that we've had 3 consecutive balanced budgets, we're ready to invest big in broadband because Nova Scotians need it. It is essential, I agree with the member, and that's why we're going to invest big and we're going to support Nova Scotians to that end. Thank you.
The Honourable Member for Queens Shelburne.
Thank you for that answer, Minister. People want to move to Queens County and set up businesses and employ people. However, rural internet service is prohibiting such opportunities from happening, as outlined in a message I received in January. In a few months, we'll be returning to live in our beloved Queens County, specifically LaBelle. We are concerned, however, that the lack of decent internet will stop our efforts to pursue business opportunities in our community, and that we may be forced to relocate in order to support ourselves. I know the Minister has pretty much answered my question, but I'll ask the question once again. Will the Minister commit today to making the investments necessary to ensure all Nova Scotians can pursue opportunities no matter where they live?
The Honourable Minister of Business.
Thank you, Mr. Speaker. And again, it is a critical issue for us and for many people in this province. Connectivity is important for security and safety first and foremost, but we've got so many initiatives that are tied to the rural economy and growing the rural economy and keeping people home, growing businesses, allowing innovation, entrepreneurship to take place. We can't do that without decent internet access, to the member's point. So again, we will be making a major investment in broadband for this fiscal year and many years to come, and the member can tell her constituent, don't go anywhere, stay where she's at, because the broadband service will be coming soon. Thanks.
The Honourable Member for Cape Breton-Richmond.
Mr. Speaker, my question is for the Minister of Transportation and Infrastructure Renewal. A few days ago, I spoke in this House regarding a constituent of Cape Breton-Richmond who operates a fishing company. They were concerned about the lack of cell phone coverage in the Grand River Froboise area and the challenges this presents to their business. Today, I would like to table a letter from another constituent who operates a trucking and excavating company. They struggle to communicate with their employees from the moment they leave the yard. I am certain, Mr. Speaker, that the Minister places a high priority on the safety of his TIR staff when they are in the field. Does the Minister feel confident sending his staff out to work with heavy machinery in areas without reliable cell phone coverage?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. The department has an internal radio system which the province has invested significant money into, and is an alternative to areas where the cell phone service might be spotty. Thank you.
The Honourable Member for Cape Breton-Richmond.
Mr. Speaker, it must be fabulous to have an onboard radio system. I wish that the residents of Cape Breton-Richmond would all have access to one as well, but they don't. Beyond the business implications, a lack of cell service presents safety issues for this company when their employees are out in the field. In fact, surely the Minister understands the importance to accessing emergency services, considering the issue I brought forward recently in this House regarding one of his department's pickup trucks being completely engulfed in flood conditions on the Loch Lomond Road. That vehicle lost power, and they were just able in time to make a call before their radio system went down. On Wednesday, the Minister of Business stated that he believed reliable cell service was necessary to operate a modern business. Does the Minister of Transportation believe that cell phone services is an important part of infrastructure in this province as roads or electricity?
The Honourable Minister of Transportation.
Yes.
The Honourable Member for Colchester Musquodoboit Valley.
Thank you, Mr. Speaker. My question is for the Minister of Education. Multiple constituents on the Lays Lake Road have children requiring bus services to get to school. We have received multiple phone calls from families stating that the bus will not be traveling on that road for the remainder of the winter. A couple of the parents reported never receiving notice that this was going to take place. The young children of one family who were normally dropped off at their grandmother's house only found out they were being dropped off at the end of the road when the bus doors opened. Will the minister be creating standards for busing services so that poorly maintained roads will not be used as an excuse for failing to deliver students to and from home to school and return?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Of course, transportation policy is one of the areas that we can now look at through a provincial lens. I do know that when it comes to roads that have challenges, particularly this time of year, there are safety issues to be concerned about as well. And of course, the safety of our kids getting to and from school is absolutely paramount to any decisions that we make provincially and locally.
The Honourable Member for Colchester Musquodoboit Valley.
Just in that particular road, I drove it a couple of times during the winter, and there are moments when the bus cannot get through, but there are also many times when it can. A school bus picking children up at the Musquodoboit Valley Elementary School is reported to be extremely unreliable. There has been no communication at all with the parents, and phone calls to the school board are referred to stock transportation. And when you phone stock transportation, they don't get back to you. So will the minister be reviewing the busing policies in HRM and follow that up on the continued complaints about school transportation in the Musquodoboit Valley Elementary School District?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Now that we do have a unified system, transportation is one of those key areas where we can look at, as I mentioned, through a provincial lens and make sure that best practices are being employed from one end of this province to the other.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Transportation and Infrastructure Renewal. The future of the massive Bloomfield complex has been up in the air for years. Halifax Regional Council voted last August to sell a portion of the site to the provincial government with the hope it would be turned into a school. The 120-day window for that sale came and went without an official response. A letter from the Department of Transportation and Infrastructure Renewal dated January 15th says the province is unable to consider Council's offer. Also in January, chain-link fencing and private property signs went up around the publicly owned land. Mr. Speaker, given the significant needs for public infrastructure, for public housing, health and education facilities on the peninsula, why is the minister risking this public property be sold into private hands?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you, Mr. Speaker. And the disposition of the property is the purview of the Halifax Regional Municipality. In terms of securing the property, it's always in the best interest of the public to make sure that all our properties are safe. Thank you.
The Honourable Member for Dartmouth North.
Mr. Speaker, the 2016 report by the Auditor General found that the government decisions on school capital construction are ad hoc and unsupported by often unsupported by analysis. The CSAP had hoped Bloomfield could have been the site for a new P-12 school. The HRSB also submitted a capital request for a new North End Junior High School. Despite all the reforms just put through, the legislation passed last night by this government has made no improvements to the school capital process. Mr. Speaker, what is the minister doing to make sure there is a transparent system for school capital planning in place so communities can make sure their voices are being heard by this government?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you, Mr. Speaker. My department is informed by the decisions of others at the education chain who determine where the processes are, and the engineering expertise that our department has is employed to produce the finished facility. It would appear on the surface, though, that the very act that the member refers to will enable us to make more informed decisions and move with greater speed in implementing those decisions.
The Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker. My question is to the Minister of Natural Resources.
Over the past 3 or 4 weeks, the residents of the Ingonish Beach area have been contacting my office as well as the local councillor because they're concerned about the number of coyotes in the area. Over the past few months, the number of coyotes has been steadily increasing, not only in the Ingonish Beach area, but on the North Shore and Tarbert areas as well. One resident has reported seeing 5 in her driveway when she prepared to take her dog for a walk. Needless to say, she stayed in her home. So my question is, what does the Minister's Department do to investigate and control situations such as this, especially when it's one that could affect the safety of the residents?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member for this question. This is certainly something that our department is very, I want to say keen on, but certainly we want to make sure that the safety of residents and whenever it concerns wild animals is first and paramount. So I would encourage the honourable member, if there are any complaints, to forward them to our department. We will have staff go out and investigate those complaints, and if we find that there really is a danger to the public, we'll be able to take some action. Thank you, Mr. Speaker.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker, and I thank the Minister for that response. I know that there has been contact made with the local depot in her department. Mr. Speaker, a number of residents of the Ingonish Beach area have indicated they've seen the coyotes around their houses. One even went right up to the doors of one home. Residents are becoming very frustrated and concerned for their children and their pets, and are living in fear. Some residents are even talking about shooting them, which could lead to even more issues. So my question, will the Minister have her department do everything possible to eradicate these concerns as soon as possible for the safety of the residents of Ingonish Beach?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member. Certainly, as I've said, safety is certainly going to be paramount in dealing with this. If indeed this is found after investigation by the department to be the case, we'll be able to take some action to make sure that the residents are not ever in danger. Thank you.
The honourable member for Inverness.
Speaker, question for the Minister of Health. We hear about the new collaborative health centres. And as I understand, Mr. Speaker, the idea is there are to be nurse practitioners there and other health professionals, but essentially you can see a nurse practitioner, and if there is a need to see a family doctor, they can get you access to that doctor. But Mr. Speaker, I know I'm hearing from people in my constituency who have been told this, and we're hearing in other parts of the province, that you have to choose whether you want a nurse practitioner or a family doctor. And you can only have one or the other. And if you refuse the nurse practitioner, yes, you can stay on the doctor wait list, but if you take the nurse practitioner, you're off the doctor wait list. Can the Minister tell us, do you only have the option of choosing one or the other?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I think what the member's referencing is registering on a roster with, so that's just paperwork identifying who the primary person they go in to see is, Mr. Speaker. But the whole point and the way that these collaborative practices and collaborative teams work is they work as a team, Mr. Speaker. If they needed to see a general practitioner, a family physician, that they would have access to those services as well.
The honourable member for Inverness.
Mr. Speaker, I do hope that is the case, and I take the minister at his word, although I would like to raise this concern because this individual was told that if you stick with the nurse practitioner and you need to see a family doctor, you should go to the emergency department. So maybe it is a case of misinformation, but it came from somebody fairly high up in the health authority. And it begs the question, Mr. Speaker, is the goal of the government to help people to see a doctor when they need one, or is it to get them off the family doctor wait list so they can talk about how they're finding family doctors for people?
Honourable Minister of Health.
Thank you, Mr. Speaker. As I had the privilege yesterday to make an announcement about 7 additional collaborative practice teams being implemented across the province, as well as expanding and strengthening 16 others, Mr. Speaker. We made it very clear, as did the physician and the nurse, family practice nurse that were part of that presentation over in Dartmouth, Mr. Speaker, that in fact they do work collaboratively together, that they do share support for the patients in their community, and both, who have decades of experience in healthcare, spoke about how amazing this experience, although only 1 month old in their practice, how amazing that experience has been for both the physician and the nurse. Thank you.
The honourable member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker. My question to the Minister of Education last September, I asked the Minister a question about courtesy bus, and parents have continued to express their concerns with the maximum distance that province to school boards are setting for walking and busing. Distances set provincially are set at 3.6 kilometres, and a student can be bused whether they are 5 or 18 years old. Halifax Regional School Board, of course, has a policy of 2.4 kilometres. The Minister has said that the standardized policy across province is one of the objectives of centralization. And in September, the Minister actually said, and I would quote and table, there are many out there who would agree that having our children walk to school is a healthy exercise. Minister, I would like to know, Mr. Speaker, if the Minister will commit to coming to my constituency and joining myself and a 5-year-old as we walk the 7.2 kilometres to school and back.
The Honourable Minister of Education.
Thank you very much.
Order, please. The time allotted for oral questions put by members to ministers has expired. Will now